Hi everyone, good day. This is Dr. Von and I will be one of your lecturer for Histopathology. To formally introduce myself, you can simply call me Sir Von or Doc Von. I am also a graduate of this institution way back 2013. Then, I worked as a full-time medical technologist at Digos Doctors Hospital for almost 2 years and as well as a part-time instructor for clinical chemistry in this institution also. Then, I decided to pursue medicine at the West Visayas State University College of Medicine in Iloilo City, batch of 2019. Then, I went back to Davao City to have my postgraduate internship at Southern Philippines Medical Center. And then, I just recently passed my physician's licensure examination last November 2020. Then, I decided to come back first in an academe in this institution to teach, and since teaching is really one of my passion, before I will continue my residency training, hopefully also in pathology. So I'm very excited to be part of this team, and hopefully we will have a fun learning experience in histopathology. Shall we begin? So for our discussion for today, our main reference will still be your Robin's Basic Pathology. So I am actually using the 10th edition. However, you can still read on your 9th edition because some parts of the 10th edition, as a 9th edition, hindi na nila dinagdag sa 10th edition. But I guess there are some parts in the 9th edition that is still, I wanted to teach with you. So you can browse either your 9th or your 10th edition. So for today, our topics will be your General Pathology and your cellular injury and cell death. So this is a 2 topics, but we will try to, the idea of discussing this one is to give you the concepts that you need to learn so that you will have a full grasp or understanding about the importance of histopathology. So for our learning objectives for today, at the end of this lecture video, the student is able to, first, we will define the different terms associated with pathology. Most importantly, we will define pathology or what is pathology all about. Then, we will explain the 4 aspects of disease process. Itong 4 aspects of disease process is actually the core of the pathology. So, without understanding this one, then we will never understand pathology. Then, we will define the division and scope of pathology. Then, we will discuss the causes of cell injury, not just the cell injury, but not just the causes, but rather we will also try to discuss the different mechanisms of cell injury. So, this is going to be the second part of our discussion. Then, we will differentiate the types of cell death, explain the mechanism as what I said a while ago, and then we will also, since this is histopathology, we will go at the cellular level. That's why we have to check the different microscopic changes in reversible and irreversible injury. Then, we will differentiate the types of necrosis, and lastly, we will identify also the microscopic tissue findings in necrosis. For us to be guided with our discussion for today, this is going to be our topic outline. First, we will define your general pathology, the importance or the different definition or terms related to general pathology. Ito yung first topic na i-discuss natin. We will try to define, to check the division and the aspect of disease process of your pathology. Then for our second topic, we will be discussing about your cellular injury and death. Dito, we will discuss the different causes, mechanisms, as well as the reversible injury and the irreversible injury, specifically your necrosis and apoptosis. So this is going to be our topic outline. So let's start with our first topic. I hope that we will have a fun learning discussion for today. So general pathology. So let's first define pathology. So what is pathology? Yan pinaka-importante. Doc, ano po ba ang pathology? So from the Greek word, it actually comes from the Greek word pathos and logos. Pag sinabi nating pathos, it is actually means suffering. And logos, we already know that, but it ends with logi or logos. It's actually study. So meaning to say, it is the study of suffering. So we are referring to the disease process. So technically, this is the study of suffering or the study of disease. Because in pathology, we are talking about the disease process. So that's why it is the study of suffering, the study of disease. So in technical terms, when we say pathology, it is a study of structural, biochemical, and functional changes in cells, tissues, organs that underlie the disease. That's why we are really talking about a certain disease. Study sa kanyang structural, biochemical, and functional changes sa cell. So, in pathology, we are already talking about it a cellular level. Cellular level, we check the changes, functional or structural changes sa ating cells and also sa tissue. Remember, our tissue is composed of our cells. Our organs is also composed of our tissues. So technically, we are still looking into the cell. The cell. So we are already at a cellular level to check the different disorders or diseases. So our pathology uses molecular, microbiologic, immunologic, and morphologic techniques to attempt to explain the signs and symptoms manifested by the patient. Later on, when we talk about the disease process, we will be explaining more about the signs and symptoms. And also, this is now the part of the medical technology that we will be using a lot of techniques for us to detect the different disease or disorder. Dito na natin lumalabas ang ating pagiging medtech. Later on, all throughout the histopathology course, we will know the different techniques for us to detect certain disorders or diseases. And also, ito ang pinaka-importante sa pathology. Your pathology is actually the bridge between the basic sciences and clinical medicine. So, meaning to say, whatever learnings you have in histology, physiology, anatomy, dito na natin ma-apply lahat ng mga na-learn natin sa normal physiology, anatomy, histology nang na-learn nyo sa previous discussion or sa previous courses, because it will give us, pathology will now serve as a bridge for us to understand clinical medicine. When we say clinical medicine, yan yung internal medicine, yan yung surgery, yan yung OB. I know you're not familiar with it, but pathology will explain why patient is manifesting such condition. Anong explanation? Doc, bakit nagkakaroon ng fever ang pasyente? Bakit nagkakaroon ng allergy ang pasyente? It's because of pathology. That's why it is important for us to know what is normal before we will understand what is abnormal. Kaya nga, ni-require kayo na dapat alam nyo yung histology, alam nyo yung physiology, alam nyo yung anatomy, because we will never understand pathology. We will never understand any abnormality if we do not know what is normal. So this is the importance of your basic sciences. So your pathology, in short, is a scientific foundation for all of medicine. So, ito yung nakakaganda sa pathology. It will discuss everything. If you know the pathology of a certain condition, then you will understand why patient is suffering from such condition. So, let's tackle about the divisions of pathology. So, divisions of pathology, according to Robbins, it is only divided into two. We have your general pathology and your special or systemic pathology. When we say general pathology, it's the reactions of cells and tissues to abnormal stimuli and inherited defects. So such reactions are often not tissue specific. So meaning to say you are not tissue specific. For example, you have acute inflammation. So later on, all throughout the histopathology course, may certain topics about inflammation. But for now, ito yung idea ha. For example, you have acute inflammation. So, in response to a bacterial infection, produces a very similar reaction in most tissues. So, meaning to say, for example, may inflammation ako sa baga. It is the same inflammation pag nangyayari ako ng inflammation sa aking puso. So, technically, we are talking about general pathology, similar reaction. So, this is not tissue specific. Yan yung idea. Pag sinabi nating special or systemic pathology, specific responses or specialized organs and tissues that are responsible for disorders that involve these organs. Kumbaga, sa systemic, we are already talking a specific organ. We are talking disorders sa ating puso, disorder sa ating lungs, disorder sa ating kidney. So we are talking a special or specific organs. Kaya tinatawag natin na special or systemic pathology. Unlike general pathology, kahit sa anong parte ng katawan. For example, may inflammation ikaw, pwedeng magkaroon ng inflammation sa kidney, pwedeng magkaroon ng infection sa lungs. So in short, it is not specific to a certain condition. The reaction of cells and tissues to an abnormal stimuli is not specific on that organ. It can happen on different parts of the body. While on systemic pathology, dyan na yung very specific. May specific pathology sa puso, specific pathology sa kidney, specific pathology sa ating baga. When you scan your Robbins or I am very sorry, when you scan your Robbins or your book, you can see there may per chapter may specific organs. May chapter para lang sa puso, may chapter specific for the lungs, may chapter specific for the kidney. So that's what your systemic pathology. So yan yung divisions of pathology. Now, let's proceed with your 4 aspect of disease process. Ito yung pinaka-importante na dapat nating malaman because these 4 aspects of disease process will serve as the core of your pathology. Without understanding this one, we will never understand pathology. That is why I want you to really understand or grasp the idea of the aspect of disease process. Ito yung pinaka-bulk ng ating learnings for today for our first discussion. Check natin. Doc, ano po ba yung core 4 aspect of disease process? Ang 4 aspect of disease process natin, meron tayong etiology, meron tayong pathogenesis, meron tayong morphologic changes, and lastly, we have your clinical manifestations. First, we will have an overview. Overview lang muna natin. Of course, later on, we will have a very nice case. We will have an example on each of these aspects of disease process. For now, we'll have an overview first. Pag sinabi nating etiology, you are actually referring to the cause of the disease. Cause of the disease. Without the cause of the disease, pathogenesis, morphologic changes, clinical manifestation will not happen. In short, kailangan ng etiology for these other 3 aspects of disease process to occur. Meaning it is the cause, the origin of the disease. That's etiology, the basic concept ha. We just talk about the basic concept. Pag sinabi nating pathogenesis, you are referring to the development of the disease. You are talking about the sequence of the disease. From the name itself, patho. Remember, patho is suffering. Patho is disease. Genesis. What is Genesis? Diba in the Bible, in the beginning, simula, origin. We are talking about the beginning of the disease. But in pathogenesis, we are not only talking about the beginning of the disease, but we are talking about the development process of the disease. We are talking about the sequence of events or the mechanism of the disease. So, ano ang nangyayari sa atin? Kumbaga, sequence of event brought about by etiology. Next, morphologic changes. Sa morphologic, sorry, pumipiyok si Doc. Sa morphologic changes, we are talking here about the cellular level. Remember, pathology, we are talking about the cellular level. So in short, sa morphologic changes, we are talking about the structural, functional, or biochemical changes na nangyayari sa ating cells brought about by your pathogenesis. Sa morphologic changes naman, because of the changes na nangyayari sa ating cells, it will result into a dysfunction. Because the cell cannot do its function, what will happen? Then it will result into a clinical manifestation. Yung clinical manifestation, ito na yung nararamdaman ng ating pasyente. This is now the signs and symptoms manifested by our patient. Ito yung nakikita natin or nararamdaman sa pasyente brought about by the morphological changes. So ngayon, we will now go on each of these aspect of disease process. Isa-isahin natin para mas lalo nating maintindihan. So, what is etiology? Again, ito yung sinasabi ko. This is the origin of disease, which may be intrinsic or genetic, or it could be acquired. Pag sinabi nating acquired, it can be infectious. Ano yung mga infectious? Pwedeng bacterial, pwedeng viral, pwedeng fungal. Nutritional, pwedeng in excess or deficient. Remember, you can have a certain disorder if whether you have an excess or deficient of a certain nutrition, right? You can also have chemicals. You may have exposure to certain chemicals. That's why you have that certain diseases or physical problem. So when we say intrinsic or genetic, it's actually referring to the inherited mutation. So this is a disease-associated gene variants, meaning to say, meron kang na-inherent na gene defect. That's why that's your intrinsic or genetic. Doc, question doc, a certain disorder or disease, pwede bang kailangan lang ba na isa lang ang etiology for a certain condition? Of course, pwede. For example, you have pneumonia. What would be the basic etiology of that? Then, of course, we know that it is brought by a infectious agent, most specifically or commonly brought about by bacteria. Pero remember, it is not only brought about by bacteria. Pwedeng viral, pwedeng other causes. Maraming causes ng pneumonia. But commonly, it is brought about by a bacterial in origin. But there are certain conditions, a lot of disorders or diseases is brought about by not only by the acquired or the intrinsic. It could be a combination of intrinsic or acquired. Pwedeng multiple causation. Ito yung tinatawag namin na multiple causation. For example, I have cancer. Is cancer brought only about by genetic defect? Of course, hindi lang. There are a lot of factors why a certain person develops cancer. Pwedeng infectious. You may have a viral diseases that leads to cancer. Remember, you will also have a genetic defect or genetic susceptibility why you will develop cancer. Meaning, you will have a lot of causation. Meaning, in etiology, it's not just brought about by a single cause, but it could also brought about by a multiple causation. Yan yung gusto kong malaman nyo. It can be brought about by multiple causation. Again, pag sinabi nating etiology, always remember, talk about by the origin of the disease or the cause of the disease. Yan lang, simple. Pag narinig ang salitang etiology, the cause of disease, origin of the disease. Very good. Now, let's proceed with your pathogenesis. Again, anong ibig sabihin nga pag narinig ang salitang patho? Pag narinig natin ang salitang patho, suffering, disease. Pag narinig ang salitang genesis, remember, it's in the beginning, ang simula ng lahat. So, we are simply talking about the development of the disease. It's the mechanism of its development or sequence of events in response of cells or tissues to the etiologic agent. It's actually the spectrum of disease. So, pag sinabi nating pathogenesis, it's actually describes the chain of events leading to the disease. Chain of disease. Anong nangyayari? Hindi kasi pwedeng, for example, ang pasyente natin nagkaroon siya ng pneumonia. For example, ang pasyente may pneumonia. Of course, we know the cause of our patient na nagkaroon siya, ang cause of that pneumonia, for example, is bacterial or viral. Hindi pwedeng nagkaroon siya ng bacteria, agad-agad nagka-pneumonia siya, hindi agad umuubo siya, hindi agad nagkaka-fever ang pasyente. Of course, there is a chain of events. Bakit inuubo ang pasyente? Bakit nagkakaroon ng fever ang pasyente? Meaning to say, you are talking about the development or sequence of event. You are talking about the chain of event leading to the disease. In short, it is a development or progression of the disease. Hindi pwedeng from this one, from that disease, naging agad-agad malala. So what happens in between? We have to know the sequence of event for us to understand why the patient have a kind of manifestation. So again, let's review etiology. We are talking about the cause. Pathogenesis, we are talking about the sequence of events brought about by the etiology or the cause of disease. So now let's proceed with the third aspect of the disease process. Dito naman sa morphologic changes, we are talking about at the cellular level. Since this is pathology, we are talking about at the cellular level. It is a biochemical and structural alterations induced in the cell or organs that are characteristic or diagnostic of an etiologic process. Remember sa ating pathogenesis, may sequence of event, may nangyayari sa ating cells. Sa bawat event or sequence or progression ng ating disease na yan, there will be a morphological changes na nangyayari sa cell. Kumbaga, bawat sequence or events na nangyayari dito sa pathogenesis, meron ding nangyayari sa ating cell. So, merong structural alteration. Kaya nga, if you check it in a microscope, nakikita natin, wala nang cell membrane ang ating cell. Lumalabas yung cellular content. That refers now to the morphological changes. But not only the structural alteration, but also the biochemical changes. And this alteration will help us diagnose or identify the disease process or the etiologic process. So that's your morphological changes. Lastly, we have your clinical manifestation. Ang clinical manifestation is actually the functional consequences and the derangement of the morphologic changes. In short, because of the morphological changes, because of the alteration sa ating cell, structural biochemical alteration sa ating cell brought about by the morphological changes, magkakaroon tayo ng functional consequences. The cell or group or tissue or organ will not be able to provide its own function. That's why nagkakaroon ng functional consequences or derangement of the morphological changes. And that's gonna be your clinical manifestation. Ito na yung nararamdaman ng ating pasyente. When we say clinical manifestation, it can either be signs or symptoms. Doc, anong difference ng signs or symptoms? Pag sinabi nating signs, it's actually the objective, observable phenomenon that can be identified by another person. Again, pag sinabi nating sign, remember that it is an objective, observable phenomenon that can be identified by another person. Meaning, nakikita ko sa pasyente ko. For example, ako yung doktor. Anong nakikita ko sa pasyente ko? That's a sign. Objective. Nakikita ko sa pasyente ko. Symptom. What is a symptom? A symptom, on the other hand, is a subjective experience that cannot be identified by anyone else. Meaning, yan yung nararamdaman ng aking pasyente. Of course, hindi ko yan nararamdaman. Nararamdaman ng aking pasyente. So, in simpler terms, pag sinabi nating sign, objective na nakikita ko sa pasyente ko. Symptoms is subjective na nararamdaman ng pasyente. So, in simpler terms sign, nakikita ko sa pasyente ko. Symptoms, nararamdaman ng pasyente ko. Sige nga, Doc, anong example niyan? For example, may pasyente ako, Doc, meron po akong pantal-pantal. Of course, nakikita ko may rashes ang pasyente. Is that a sign or is that a symptom? Sige nga, even though hindi tayo in a face-to-face setup, try to answer for us to assess yourself. Is it a sign or symptom? Doc, nakikita ko na may pantal-pantal ang aking pasyente. Is that a sign or a symptom? Of course, that is a sign because nakikita ko sa pasyente ko na may pantal-pantal siya. Pero pag sinabi ng pasyente, Doc, yung rashes ko makati po, sobrang kati ng rashes ng pasyente ko. Is that a sign or a symptom? Sige, try to answer. Try to assess yourself. Is it a sign or a symptom? Of course, that is a symptom. Subjective feeling ng pasyente. Nararamdaman niya na makati yung rashes. Hindi ko naman nararamdaman na makati yung pasyente. Ay, parang mali yung statement. Makati ang pasyente. Hindi ko naman nararamdaman na nangangati ang pasyente. That's the correct statement. Mali yung statement ko. I'm sorry. So, hindi ko nararamdaman. Nararamdaman yun ng pasyente na makati ang kanyang rashes. So again, pag sinabing signs, nakikita ko sa pasyente ko. Pag symptoms, nararamdaman ng pasyente. Another example, Doc, masakit po ang puso ko. Doc, may chest pain po ako kasi iniwan po ako ng jowa ko. Char. So masakit daw ang kanyang puso, may chest pain daw ang pasyente. Is that a sign or symptoms? Masakit daw ang kanyang puso kasi iniwan siya ng jowa niya. Is that a sign or a symptom? Of course, hindi ko naman nararamdaman yan. That is a symptoms because yan yung nararamdaman ng ating pasyente. Sana yung heartache or yung chest pain naging signs na lang, no? Kahit hindi niya man nararamdaman, at least nakikita niya na masakit iwan. Char. Of course, remember, chest pain is a symptom. Pero sana naging sign na lang, no? Para at least alam nila gaano kasakit maiwan. Char. So, sign or symptom. Please do not forget that one. So, again, let's review the 4 aspects of disease process, ha? Etiology, pathogenesis, morphologic changes, clinical manifestation. So, this is now the summary of what we learned. Etiology, the cause. Ito talaga ang origin ng sakit. Kung walang etiology, walang pathogenesis, walang morphological changes, walang clinical manifestation. Meron pala akong, excuse me. So, let's check ha. Ano nga yun? Etiology is the cause of the disease. Pag sinabi nating pathogenesis, it's now the sequence of event brought about by the etiology. Because of the sequence of event or the progression of the disease, there will be morphological changes. Not only on the structural changes sa ating cells, but also functional changes. Because of these structural or functional changes, it will now lead to the clinical manifestation of the patient. In clinical manifestation now is the signs and symptoms ng ating pasyente. Diba? As what you can see, without understanding this 4 aspect of disease process, then we will never appreciate pathology. Ito yung nakakaganda ng ating aspect of disease process. If we were able to identify all of these aspect of disease process, if we were able to grasp the concept, then we will understand the pathology of a certain disease or a certain disorder. So again, let's have a simple example. So, dito na tayo, bigay tayo ng isang simple na case. For example, we have a 55-year-old male patient. So, ibibigay ko na lang ang diagnosis para at least we will able to identify the different etiology, pathogenesis, and morphological changes as well as the clinical manifestation of the patient. Excuse me, drink pa muna ako ng water, guys. Sorry. Excuse me lang. Okay. Excuse me. So, etiology. So, we have a 55 male patient who came in due to coughing. Tapos, i-diagnose na lang natin ang pasyente natin na may classical pneumonia or what we term as her lobar pneumonia. We know that pneumonia is brought about by a lot of etiology. Hindi lang naman bacteria ang nagkakaroon. Bacteria ang reason bakit nagkaka-pneumonia ang pasyente. But for the sake of our discussion, let's just make our etiology brought about by the bacteria. It is acquired, infectious, and specifically we are talking about a bacterial in origin. So, ito yung etiology ng ating pasyente. Classic pneumonia, bacteria. So, what is the pathogenesis of this disease condition? So, alam na natin, ang pneumonia ng pasyente natin is brought about by bacteria. So, what would be the disease process or the progression of the disease brought about by, by pneumonia? So in pneumonia, it's gonna be the pathogenesis. Ito na yung stepwise process na nangyayari sa ating cells. Later on we will explain one of these. But for the sake, guys, do not memorize this one, ha? This is not part of the discussion. This is only an example for you to understand. I don't want you to memorize this, edema, red hepatization. Of course not. This is just an example for you to identify the concept of your disease process. Sige, check natin ha. Pathogenesis, edema, red hepatization, gray hepatization, resolution. Ito na yung tinatawag na progression ng disease. If you will able to acquire this bacteria sa ating lungs, ang initial phase ng gagawin ng bacteria is that to do edema sa ating baga. That's the initial phase, edema, followed by red hepatization, followed by gray hepatization, followed by resolution. So resolution is actually the final phase of your pneumonia. Ito na yung healing where healing occurs. So this is the pathogenesis, basic pathogenesis of pneumonia. Initial phase niya, first may edema, red hepatization, gray hepatization, and lastly, the healing. Bawat pathogenesis nito, bawat nangyayari or phases ng ating pneumonia, there will be morphological changes na nangyayari sa ating cells. So, tingnan natin yan. So, ito na yung tinatawag. Ito na yung, actually, what happens in the pathogenesis, there will be a morphologic changes na nangyayari. So, in short, sabay-sabay ang nangyayari. It's a simultaneous na nangyayari. First, anong unang-unang nangyayari sa ating lungs o sa ating baga? There will be congestion. There will be congestion. This is the initial phase of your pneumonia. Yung stage of congestion or edema. If we check that on a microscope, ano kaya ang makikita natin ng morphological changes? Sa morphological changes na nangyayari natin, there will be active hyperemia and edema. Tingnan nyo, maraming mga cells na nagso-surround sa ating alveolus. Bakit kaya, Doc, maraming cells na nag-surround sa ating alveolus? Because of the presence of bacteria. Nandito ang ating bacteria inside of our alveolus. And one way of eliminating that is to increase the cells so that they will try to eliminate that bacteria. That's gonna be the first initial phase of pneumonia, stages of congestion or the edema phase. Following days or following hours or days, ang next stage gonna be your stage of red hepatization. Sa red hepatization, because of the presence of bacteria, dadami ang ating neutrophils, magkakaroon ng congestions and fibrin formation. Doc, I know you still don't have hematology. You will learn that in hematology. Remember, your neutrophil is the cell. This is a white blood cell that is responsible in attacking your bacteria. That is why sa stage of red hepatization, dadami ang neutrophils. Tingnan nyo, dumadami ang neutrophils because they will try to attack that bacteria inside the cells. And then, kaya siya tinawag na red hepatization because lalong dumadami din yung mga red blood cells. But the main goal here is to eliminate your bacteria. Next stage, following hours and days, magiging stage of gray hepatization na siya. Anong nangyayari sa stage na yan? Sa stage na yan, nade-destroy yung red blood cells and tingnan nyo, lalong dumadami yung ating WBC. Lalong dumadami yung mga macrophages because they want to eliminate the debris as well as your bacteria. They want to destroy that bacteria because that is not normal. Because if there's a presence of bacteria there, then the lungs cannot be able to do its function. So lastly, if your WBC is able to eliminate those bacteria, the initial phase or pathogenesis or the final stage of your pneumonia will be the stage of resolution. Ito na yung stage ng ating healing. So I guess you were now able to appreciate what is pathogenesis and morphological changes. Pathogenesis is the sequence of event or the progression of the disease until such time that there is healing. Then morphological changes will depend on what will happen sa ating pathogenesis. Kung stage ng congestion, of course, dumadami ang cells. Stage of red hepatization, mas lalong dumadami ang ating WBC. Stage of hepatization, mas nadidestroy yung mga RBC. Then mas lalong dumadami ang ating mga macrophages. So see, it's a stepwise process. Hindi agad-agad from stage of edema, nagkakaroon na agad ng healing. Walang ganon. Hindi siya ganon. It's a stepwise process. You have to have a stepwise process for us to identify what will be the morphological changes. So that's why we will now able to appreciate morphological from your pathogenesis. Doc, ano naman yung clinical manifestation? Doc, bakit nagkakaroon tayo ng clinical manifestation? Remember, clinical manifestation will happen because there is a dysfunction on the part of the cell. Kung ang cell natin will not be able to produce or to do its function, then a clinical manifestation will arise. Anong ibig sabihin yan, Doc? For example, sa ating case ng classical pneumonia, meron tayong cough, meron tayong tachypnea, meron tayong fever, meron tayong abnormal finding, chest finding. This is actually brought about by the morphological changes. Tingnan natin, unahin natin cough. Bakit, Doc, inuubo ang pasyente? Bakit kaya inuubo ang pasyente? Number one, Because may presence ng bacteria. Of course, at an initial stage of your pneumonia, your body will try to eliminate that presence of bacteria inside your alveolus because it's not normal. It will try to eliminate that bacteria. Paano niya i-eliminate ang bacteria? Coughing is a reflex. That's why the patient will try to cough out that bacteria or eliminate that bacteria. Kaya nagkakaroon ng cough ang pasyente. Pero habang tumatagal, if there's still a presence of bacteria, lalong napapansin nyo, lalong lumalala ang ubo ng pasyente. Next, Doc. Bakit nagkakaroon ng takip niya? Ano ba ang takip niya? Your takip niya is a increase in the respiration or lalong bumibilis ang paghinhawa ng pasyente. Mas mabilis. Diba? Yung pagkakaroon tayo ng pneumonia, lalong bumibilis ang paghinga ng pasyente. Bakit kaya bumibilis ang paghinga ng pasyente? Tingnan natin. Remember, this is your alveolus. If may presence ng bacteria dan, it will send signals to your other cells para patayin yung bacteria. Of course, dadami ang mga RBC, dadami yung mga WBC, meron ding mga presence ng RBC, meron ding mga product ng ating mga fibrin. They want to eliminate the bacteria. But what will happen? Nako-congest. Tingnan nyo, nako-congest ang ating alveolus. Ano bang trabaho ng ating alveolus? Ang trabaho ng ating alveolus is to transfer oxygen from the lungs to the blood para magkaroon ng oxygen sa ating katawan. Pero because of the presence of this WBC, RBC, other products na itry nilang i-eliminate ang ating bacteria, do you think there's still enough oxygen to eliminate, to provide our body? Of course, hindi na kasi nako-congest ang ating alveolus. Tingnan nyo, nako-congest ang ating alveolus as a mechanism of our body to increase oxygenation because kailangan natin ng oxygen ng katawan. So as a way or mechanism to increase oxygenation, our body will increase respiration rate. So that's why lalong bumibilis ang paghinga ng ating pasyente because congested na ang ating, tingnan nyo, nako-congest ang ating alveolus. So that's why nagkakaroon ng takip niya ang pasyente. Fever. Doc, bakit nagkakaroon ng fever ang pasyente? Of course, tingnan nyo, meron tayong mga inflammatory cells. Later on, when you discuss inflammation, fever will explain why nagkakaroon tayo ng fever. So what you can see, marami tayong inflammatory cells. And these inflammatory cells will actually induce fever. Kaya nagkakaroon ng, fever ang ating pasyente. And lastly, we will also have different abnormal chest findings. So ito na yung physical examination na chine-check namin ng patient. So we try to auscultate. May naririnig kaming crackles. Parang abnormal ito. Lalong bumababa ang breath sounds. Right now, I know you will not be able to appreciate that. But as a doctor, we will try to assess or auscultate the lungs. May naririnig kami na alam namin na it's not normal. So that's gonna be your abnormal chest finding. So commonly, ang abnormal chest finding naririnig namin, may crackles, may wheezing. So I know you're not be able to appreciate that. But ito yung tinatawag namin na abnormal chest finding. So you see, this clinical manifestation is brought about by the different morphological changes and pathogenesis of the disease. So you see, it's just correlated. Because of these morphological changes, nagkakaroon ng clinical manifestation. And these morphological changes is brought about by your pathogenesis. And kung wala itong etiology, meaning wala itong pathogenesis, meaning wala itong morphological changes, meaning wala itong clinical manifestation. Ito na yung reason why I like pathology. Because in pathology, when you know what happens at the cellular level of the patient, you will really understand why patient is suffering from such condition. Why patient is suffering with that kind of clinical manifestation. Pathology will explain why the patient is suffering from that disease. Kaya, di ba, you will see the beauty of pathology here. So again, let's review ha. Etiology, we're talking about the cause. Pathogenesis, we are talking about the mechanism or the sequence of event brought about by your etiology. Morphological changes, we are talking about the cellular level. Anong nangyayari sa ating cells? Anong nangyayari sa ating tissues? And lastly, we are talking about your clinical manifestation. Sa clinical manifestation, this is brought about by the morphological changes na nangyayari sa ating cells. All of these four aspects of disease process is actually connected or intercorrelated. Lahat sila connected lang. Hindi pwedeng clinical manifestation is independent from the morphologic changes. Hindi ganun. Ang apat na ito ay connected. So Doc, the question is, what is the importance of knowing the four aspects of disease process? Now, the importance of knowing the four aspects of disease process is number one, for us to be able to diagnose our patient correctly. As a physician, it is important for me, dapat alam ko itong aspect of disease process because without knowing this disease process, I will never ever diagnose the patient correctly. Hindi naman darating ang pasyente at the emergency room, papasok ang pasyente. Doc, may ubo po ako, parang may pneumonia po ako. Ay, of course, sige, may pneumonia pala ang pasyente. Hindi ganun, hindi yung pasyente ang magsasabi sa akin or hindi agad-agad, may ubo ang pasyente, pneumonia to. Of course, remember, coughing is not always pneumonia. Coughing can be brought about by different disorder. Pwedeng may inuubo ka because may allergy ka or may asthma ka. Inuubo ka because brought about by other factors. Hindi lahat ng inuubo is brought about by pneumonia, brought about by bacteria. So that's why I have to really identify or understand the disease process. Ganito yan guys. To give you an idea on how doctors diagnose our patient, so I know this is way advanced in your part, but this is, kasi nga when I was a medtech student, just like you, it's always been, it's actually a misunderstanding on my part pala na doctors, kasi dati, when I was just a medtech student, akala ko, doctors will, to make a diagnosis, to diagnose a patient, doctors rely on the laboratory. Nagre-rely sila sa CBC, nagre-rely sila sa chest x-ray, para ma-diagnose nila ang pasyente. Di ba? Dati nagtatrabaho ako. Laboratory. Pag check ko ng laboratory, mababa ang platelet. Alam ko ng diagnosis ng patient, platelet. Mababa ang platelet ng patient. Alam ko ng diagnosis, possibly this is dengue. That's correct. But doctors do not rely on the laboratory to make a diagnosis. Paano yan nangyayari, Doc? We actually rely on the clinical manifestation. Dito na yun pumapasok ang importance ng disease process. We are talking about the clinical manifestation. When we diagnose our patient, 3 parameters yan. History ng pasyente, physical examination ng pasyente, and lastly, yung mga diagnostics. Pag sinabi naming diagnostics, we are talking about yung laboratory, yung CBC, yung X-ray, etc. Lahat ng mga diagnostic. When I say history and PE, I am talking about the clinical manifestation of the patient. Yung history and yung PE. That's your clinical manifestation of the patient. 90% of our diagnosis is based on the clinical manifestation. We do not rely on the diagnostics. Our diagnostic will serve as adjunct with our diagnosis only. Ang clinical manifestation is 90%. Diyan namin binabase ang aming diagnosis. Paano nangyayari, Doc? Dumating ang pasyente, for example, our patient with pneumonia, dumating sa emergency room. Sige, I'll check for the history of patient. Doc, ma'am, kailan po nagsimula ang ubo? Ma'am, kailan po ba? Meron po ba siyang associated fever? Ma'am, nahihirapan po ba siyang huminga? Then, that's gonna be your history. Doc, ano po yung physical examination? The physical examination is that dyan na kami mag-o-auscultate ng aming patient. Of course, we will do a complete physical examination. I-examine namin ang patient. Pero, for the sake of our discussion, pneumonia, may abnormal chest finding. Check namin. May narinig na akong abnormal chest finding. May naririnig akong crackles. May narinig akong wheezing. May narinig akong ganito. So, most probably, based on the clinical manifestation from the history and PE of the patient, I will now be able to generate my initial impression. Ito na yung aking diagnosis. So, hindi pa ako nakaka-request, wala pa akong nire-request ng CBC, wala pa akong nire-request ng mga diagnostics, meron na akong diagnosis. My diagnosis based on the clinical manifestation, cough, tachypnea, fever, abnormal chest finding, this is probably pneumonia. Probably because sa aking history and physical examination, this point out to be pneumonia. Because this is pneumonia, I will now request a diagnostic. Diyan na ako magre-request ng aking mga laboratory finding. Diyan ako magre-request ng aking mga diagnostic. Hindi pa ako nakaka-request, meron akong diagnosis. So, sige, because patient is most probably having pneumonia. That is why magre-request ako ng CBC. May narinig akong abnormal chest finding. Tingnan natin sa x-ray. So, my laboratory and my x-ray will serve as an adjunct to my diagnosis. It will serve as a supplemental or somehow a support system or confirmatory with my initial impression. That's why pag-check ko sa x-ray, may pneumonia nga ang pasyente ko. Sa CBC, I expected mataas nga yung CBC kasi nga may pneumonia ang pasyente ko. So with that guys, you see the importance of clinical manifestation. Dito pa lang, alam na namin kung ano ang sakit ng pasyente. Because this clinical manifestation, we will now able to picture out what happens in the morphological aspect of the patient. We will now able to identify the pathogenesis of the patient, and most probably, we will be able to identify the etiology of the patient. See, you will see the beauty of pathology. Kahit sa clinical manifestation pa lang, nako-correlate na namin ano ang morphological changes, ano ang pathogenesis, and most importantly, the etiology. It's a bacterial in origin. Hindi pa kami nakaka-request, but we will now manage our patient. Since we know, since based sa clinical manifestation, this is a bacterial in origin. Anong management namin sa pasyente? Magbibigay kami ng antibiotics so that to kill the bacteria or to remove the etiology. So our target now is the etiology of the patient. Remember, without this etiology, your pathogenesis, your morphological changes, your clinical manifestation will never occur. You see guys, how beautiful pathology is. By just knowing the clinical manifestation, you will understand the disease process. Malalaman mo na anong nangyayari sa cells, malalaman mo na anong pathogenesis, and most physically, you will correctly, ito ang pinaka-importante sa doctor, you will correctly manage the patient. You will now able to give the correct treatment of our patient. Remember, hindi lahat ng ubo caused by bacteria. That is why the different clinical manifestation of the patient is very helpful for us to correctly diagnose our patient. So that's the 4 aspect of disease process. Now, let's just have a review of everything that we discussed. Is the first part of our discussion. Grabe, first part pa lang. Pero, di ba, ang saya na. So, again, first, 4 aspect of disease process. Pag etiology or cause of disease, maraming etiology. Maraming causes. Toxin, infection, immunologic, genetic, nutritional, trauma, and etc. A lot more. Because of this etiology, it will lead to your pathogenesis. There will be progression of the disease. And after the progression of the disease, it will lead to different structural or biochemical changes that will lead to molecular, functional, and morphologic abnormalities in your cells and tissues. Because of that, there will be dysfunction of your cells that will lead to clinical manifestation, which is now your signs and symptoms. So that's gonna be our first part of our lecture discussion. Thank you, everyone.